My rule of thumb for dental hygiene in terms of production percentage in a general practice is for the hygiene department to produce roughly 1/3 of the total gross production of the practice. That's of course going to vary depending upon a number of factors. In general practices, I've seen hygiene departments produce 40% of the total revenue, and in startup practices the percentage of revenue is of course going to be much smaller. One of the things that has made dental hygiene much more exciting for me as a general practitioner is the advances in the science of treating periodontal disease. A lot more can be done today non-surgically than was possible early in my career, and that's given hygienists a chance to expand the treatment modalities that they provide. I think it is a much more interesting arena for them to practice in because of that, and the possibilities of bringing additional revenue into the practice and increasing practice profitability are significant in the hygiene department. There was a time early in my career when hygiene departments were largely seen as loss leaders. They were there to provide an ancillary service that patients expected, but they weren't looked at as a profit center in the practice. That has changed significantly. In most of the practices that I work in, though, the amount of periodontal care, I'll start that back up. In most of the practices that I work in, the percentage of patients that are treated for periodontal care is not commensurate with the amount of periodontitis that exists in the general population. Those statistics tell me that there are many practitioners that still don't diagnose and treatment plan all of the periodontal disease that exists in their patient population. And of course that's not a good thing for the patients nor for the practice. The good news is that the possibility of increasing revenue significantly in a general practice is usually sitting there in the existing patient base. It's not something that doctors have to market for. It requires, of course, scientific knowledge, but more than anything else, it requires cohesive communication among members of the team.